These bottles of drugs jostling through a Mississauga factory are destined for Canadian medicine cabinets, but not if some states have their way.
If it goes ahead, then we should be worried.
The U.S. Federal Drug Administration has agreed to let Florida import bulk quantities of Canadian generic drugs, in particular, ones used to treat diabetes, HIV/AIDS, and mental health.
We already see shortages of 10 to 15% of drugs here in this country on an annual basis, and large scale importation from Canada to Florida is just going to make that worse.
But in order for Florida to start placing massive orders, it has to clear a number of hurdles, including pushback from home. In a statement, the Pharmaceutical Research and Manufacturers of America called the FDA's decision reckless and said it poses a serious danger to public health, and said it is considering all options. Florida will also have to prove imported drugs are safe and effective and relabel them to FDA specifications, which can be costly. Despite that, at least 8 other states are waiting for similar FDA approvals. But people on this side of the border shouldn't panic just yet, says the Canadian Pharmacists Association.
Don't do anything differently. You don't need to go to your pharmacy and stock up or refill. Now that in itself could cause a shortage, so we certainly don't want to encourage people to do that.
Canada's Minister of Health also saying in a statement it will take all necessary measures to protect the drug supply.
So, Katie, what are those measures?
The Canadian Pharmacists Association basically broke it down this way. They said, first of all, a state has to find a Canadian manufacturer that's willing to produce supply for them. And then they have to go through Health Canada. They have to make assurances that any export won't threaten the Canadian supply. They even have to produce records. And they tell us that the rules are robust, but they always have to be on the lookout for loopholes. And you can bet that states are going to be looking for those. After all, the cost of drugs in the U.S. sometimes 2 to 3 times what it is here in Canada.
Katie Nicholson reporting from Toronto tonight.